the Ghana man penny, watching my PSC and then you bofocas or manga and another edina yaw. I do the na now the Danko Kufado, now catching the Ashas, they're free. While penny business in Piania pass one Ghana, the Shatter come on fellow Ghanaians. And in for COVID-19, a quite yes, I baby, I have my bedroom, baby, I did need check web for swa. You bet me a bubuna pre. Now I'm a Medocrogana, the shaman, no one fast and for and farmer. Penny in the Cassan, which they said you were COVID-19, no one man, homeless, didn't may you move. And into one is why I'm going to say, and then you were probably be a professor come now from Pom watching one down on our mobile mobile, and he said in Diana Crompodia Dom, and a Ghana diship, no one would trim pound of Varsens, and Pania, the wire, they could take COVID-19 and one quack, and will yourself and then Yanadano, Ghana, Yenya dear.
The global shortage of vaccines means that we must develop our capacity to produce our own vaccines domestically and reduce our dependence on foreign supplies. We must be self-sufficient in this regard in the future and prepare ourselves better to deal with any such occurrences in the future. To this end, the committee I established under the leadership of the world-renowned Ghanaian scientist, Professor Kwabena Frimpong Boateng, to investigate Ghana's potential as a vaccine manufacturing hub to meet national and regional needs, has presented its preliminary report, which, amongst others, recommends the establishment of a national vaccine institute to spearhead this development. Government is committed to inject seed funding of some 25 million United States dollars this year into this whole enterprise. The institute will be charged with delivering 6 clear mandates. 1, establishing local vaccine manufacturing plants. 2, deepening research and development for vaccines in Ghana. 3, upgrading and strengthening the FDA. 4, forging bilateral and multilateral partnerships for vaccine manufacturing in various areas, such as funding, clinical trials, technology transfer, licensing, and assignment of intellectual property rights. 5, building the human resource base for vaccine discovery, development, and manufacture.
Ghana man penyin na do dan kwakufu ado ne ne ekotie no penyin se wonam no watete watese Ghana fo bisai na verses ne da be na foforo beba ebi musu ne yenya nwa obi o e na akoye fast ne fa essence se ebi ma wo bi ebi ma wo baako ebi ma wo mienu obi o so ahwe baako kura nya de watumi awo bie man penyin so obi ankara koma tuniyam super na kokode num so se de tri bia wawe abo nyinam so e di sia kantam se Ghana de chia e wo so omunya pane ni bi wo bia no wo mo bewo.
Indications are that in the course of this quarter of the year, the availability of vaccines for our country will ramp up. Government is therefore standing by its commitment to vaccinate 20 million Ghanaians, entire adult population, by the end of this year, in spite of the huge global demand for vaccines by countries and the surge in infections the world over. We're expecting through the COVAX facility and the African Union 1,229,670 doses of the Pfizer vaccines from the government of the United States of America and 249,000 AstraZeneca vaccines from the government of the United Kingdom. Government is also in the process of procuring 17 million Johnson & Johnson single doses per person vaccines through the African Medium Supply Platform in this quarter. We have as such upgraded our national, regional and district cold chain facilities in order to widen our access to vaccines like Pfizer and Moderna that require -70 degrees Celsius cold chains.
Eni ayekutie ye Ghana man penyin Nana Addo Dankwa Akufo-Addo.
Na fellow Ghanaians wakasa ya no de batu dwa ekire mu se yade no wasama ni musu den COVID-19 wɔse deɛ abai kura data yi wɔno kura ne se wɔ ha dwen kɛseɛ ama sɛ deɛ wɔsi kuro ne ntisɛsɛyi nose mask yi asa bɛyɛ wɔ hyɛ biam yɛhyiaw ne nhyɛw a asɛm ato nose mask wɔkyerɛ sɛ deɛ data no kura de n'ani ɛden na wɔpɛgya ne ho saa no nose mask wobɛnya kura kama so mmienu no mmiɛnsa ɛfiri sɛ kasa mu ɛna saa ɛyɛ yadeɛ no wɔtumi spread yie na no na ɔde ato dwa sɛ sie ya ya kan die sa wo ya Ghana ni ne so de hye bi wo a eyi obetumi aye nanso refreshment ebi mam wase anya eyi nso so a aware nso so mbetumi agye moje aware no wi a eno so refreshment ebi mam every se wase e ho no ene nipa dodo no kodwa tare mu ene weyi fam we no weyi kasa ne etete so egu ya ho so ne afefe ya no eno aka ho ene yare no e kɔ danim no na mampani se yeah, Kasai says, Omanum, yeah, active case, 4,521, yeah, Nipa 821, and Afemu Ewu, Nano, and Odia to judge SM, baby, yeah, Kika credit, and I watch out do a dear enemy, and penny for the moment, yeah, papa, as a no smas and yeah, Besse, yes, Yanis a Bishawa, and yet Danta was Muma.
As of Friday, 23rd July 2021, the Ghana Health Service is now reporting that our total number of active cases stands at 4,521. Our daily infection rate for the past week is 350 cases. And sadly, 40 more people have died from COVID-19 over the last 10 weeks, bringing the cumulative number of deaths to 823 deaths since the onset of the pandemic. Greater Accra and Greater Kumasi metropolitan areas remain the hotspots of infections. This entire development is very alarming. Fellow Ghanaians, it is obvious from the data that we've let our guard down, with many going about their daily duties in clear breach of and disregard for the protocols. We cannot afford to return to the days of partial lockdowns. It is extremely troubling to note that the high compliance rate with mask wearing has fallen alarmingly. The wearing of masks in public places, fellow Ghanaians, continues to be mandatory. Enianum, na ochimi ensen ntemnie yare no asane amane ho so biom. Enam se ye ndi hihaya ne so titru ye jai mask no hye mesramo ye hihaya ayaye efa mask no no mun deso so fifia hye mask no eno ene bebo ye ho ban